dia, buenos días. Honourable conseller de Sanitat, Minister of Health of Catalonia, Secretary General of Health Department, General Directors and Directors of the Health Department in Catalonia. Welcome to you being here today in Barcelona. A special salutation to the Chinese delegation, Dr. Agao present here, I think all the colleagues from China. Thank you for coming in Barcelona today, at these days. All of you to come here today to share experiences, because today is a day, today and tomorrow, the aim is to know better. Last week I published in our website, in Mobile Capital, blog every month, this fashion blogs. And the blog was talking about how much we know about human beings. Because at the end of the day, we are not talking about technology only. We are talking about people. We are talking about women and men, kids, elderly, people healthy, people not healthy. That's the aim. Technology is the tool. What we want is to connect people, to connect better citizens with doctors, nurses, pharmacists, psychologists, to know better, to connect patients, because they know more than anybody what it means to be ill, to be sick. That is about connecting. And I'm very pleased today to have as the Minister with us, you with us, Brian O'Connor and the European Connected Health Alliance, because the mission we have together is connected. And the name is Brian, no? Connected Health Alliance. That is a venture Brian O'Connor has been for so many years now leading with success, not only in Europe and the States, now is too in China. And we have now a Chinese Connected Health Alliance. That for us is a big step forward. That's the message today, connectivity, human beings. And if you have time after, in this building, the Mobile World Capital, in the first floor, yesterday was the opening of a new exhibition. Every 3 or 4 months we change. Last one was music and arts and mobile, amazing. Now is Internet of Beings, Internet of People. Some people talk about Internet of Things. No. We don't believe in things. We believe in people. And we want, and if you have time later in the coffee break or whenever, please have a look. You will see how technology can help us to connect each other. Anyway, that's the welcome message. We talk later about a lot of things, about experiences. We have a very good speakers, very key speakers here today. But what is very important for us to have the minister and to have Brian with us to lead these days in Barcelona, in these 2 days of health and wellness. Welcome to Barcelona, welcome to health and wellness, welcome to our Congress, welcome to Mobile World Capital, our building here. And now I have the pleasure to introduce Brian O'Connor, President of European Connected Health Alliance. Brian, please.
I'm going to speak in 3 languages. So I hope you will all understand. The first part is very short. It's Buenos Dias. The second part is even shorter. It's Ni Hao to the Chinese delegation. And the third is I will speak in Northern Irish. We know it as Northern Irish. It's a form of English. But for today, I will speak very slowly so that people from England and other countries can understand us. I'm from Belfast in Northern Ireland. I'm very fortunate to be the chairman of the European Connected Health Alliance. This is an organisation which many of you I know in the room are members of, and you're very, very welcome. Those of you who are not members would also be welcome to join us. Let me give you a few facts. We're a not-for-profit organisation. We concentrate on creating ecosystems, multi-stakeholder groups throughout Europe and now further afield, because we believe, as Joan believes, that unless we can connect people, unless we can connect therefore organisations, whether it's government or academia or industry, unless we connect those organisations and people, we will never succeed in breaking the silos which are holding back much of the technology, implementation, the deployment, which would bring better patient care and greater economic benefit. It always amazes me when I realize how easy it is for all of us to use smartphones and iPads, and we would be shocked if there was no Wi-Fi. In fact, my phone ran out of battery yesterday at the Mobile World Congress, which I thought was a rather interesting thing. And you feel lost. So we all depend on these things. But do the health services use these devices and services which we are used to as easily as it should? Generally, no. In some countries, yes. But still, we have a long way to go to persuade people to work together. So over this year, we will achieve our target of having 25 permanent, active ecosystems in Europe. That will translate into roughly 100 meetings a year in Europe alone of multi-stakeholder groups, first of all dealing with their region and those problems and needs in those regions, and then sharing that best practice, successes, and importantly, failures. It's really important, I think, for people to be prepared to say, we tried this, it did not work. So we should not be embarrassed about failures. Entrepreneurism, innovation is all about trying, failing, and keeping going. So we tried to spread that throughout Europe. We reach now about 1,000 organisations throughout Europe, across all those stakeholder groups. That's why I feel hopeful that those groups, and indeed they are, will bring real innovation and real deployment. Someone asked me the other day, but I've got a great idea, why does nobody want to hear about it? The problem is, the silos still exist. The cultural problems still exist. And there's no point in pretending they don't. So one of the purposes of these meetings is to encourage all of you to go back to where you come from and make sure you break down the silos in your own region, your own city, your own country. So what I would say finally today is this. In this room, we have multi-stakeholder group. We have buyers, we have sellers, we have policymakers, regulators, politicians. So in this room, you have a great opportunity to do what I call real business. For some of you in academia, it might be finding partners to do research. For startups, many of those talking later today, for all of that, there's a real opportunity for you to make progress by making connections. And I suppose my last point and plea to all of you is this. We all go to many of these meetings. We all get really excited during the day and we meet lots of really interesting people. And we take their business cards. Or if you're really good, you get it onto your smartphone right away. I still haven't worked out how to do that. But then we go back to our offices and we have 100 emails. 3 days pass, 4 days pass, 5 days pass, and you're at the next event. And you realize you have not answered the 50 or 60 connections and contacts you made. So my plea to you is this. Please do follow up. If there's one thing that stops us making real progress in this world, it is the failure of most people, not you of course, but most other people, to follow up. So I'd encourage you to do that. And now what I'd like to do is to introduce the Minister who has been a champion for the connectivity that Joan talks about. You've got Mobile World Capital here, which is a fantastic organisation here in the city of Barcelona. A wonderful, live, vibrant test bed. If you look at Tic Salut Foundation here as well, they have created over the years some fantastic products and services which they want to share with the world, including a personal health record, including surveys of ICTs in hospitals, all sorts of things. So you have a wealth of opportunity here today to learn, to contribute. People want to learn from you as well. So I'm delighted to introduce the Minister who will talk to you about the great progress that has been made here in Catalonia. Thank you for listening.
Ladies and gentlemen, bon dia, good morning, bonjour, guten morgen, 4 languages. In first time, I would like to greet all the professionals and members of the institution attending the Health and Wellness Symposium, and especially all of these that have directly collaborated in this project, especially salutation from China delegation. As a Health Department of Catalan government, we are very proud to host this event, and especially this Congress. This is a new step forward for our healthcare system. As you probably know, Catalonia has always been a reference due to the characteristics of his healthcare model and his tradition of innovation in this area. Further, we have a strong commitment in preserving the principles of our health system: universality, public access, equity and excellence, and make it sustainable despite the economic context. Referring to this subject, we have to say that, as you well know, the current challenges facing health systems in developed countries are similar, are the same. Adopting a new approach is essential for finding solutions to these challenges. Many are the challenges that arise from the complex scenario we are living today. But in the new approach, the mobile technology are very present. Our traditional innovation is life. In our health policies are the mobile health. Is included in our policies health. Mobile and connected technologies are changing the way healthcare is delivered. Today and tomorrow, in this meeting, we have many answers. How mobile technologies can help tackle the two main challenges currently faced by health and social care systems: the chronic conditions and aging. How the introduction of technology in health and social care systems has an impact on people, patients and professionals and doctors, organizations and workflows. Connectivity is a key element of mobile health, connecting and sharing data analytics and platforms, and has a huge impact on patient management, coordination of care and efficiency. But connectivity is also the key of integrate care. Very important, the new technology, very important, the connectivity in the future of integrate care. People's aging and growth of chronic diseases, as well as economic context, are factors that add pressure not only to Catalan, like I said, health system, but to health services of many countries in the world. For our government, these are the reasons that make us introduce the necessary reforms to ensure the future of a universal healthcare model with high levels of quality. And the new technologies, the connectivity is a key, very, very important. These are some of the tools we have adopted, but we consider that in a global world, it is very useful to know and share projects and solutions. And this meeting is for projects and for solutions. For this reason, we consider that this symposium is a great opportunity to raise awareness about the reality and challenges of health systems of all countries and the technology solutions and projects that are implementing. I'd like to stand out Catalonia's role as ecosystems of research, innovation and health technological development, and has a world referent in health. We are a referent in health. We're a little country, we have a few people, but we have a world referent in health. Catalan innovation policies are the key of this equation. I like to remake Barcelona capital status in mHealth and smart cities. I hope this symposium will enable us to share knowledge about our healthcare improvements. I encourage you to continue working together to benefit of population health. We wish you a wonderful stay in Catalonia. Enjoy Barcelona and Catalonia. Thank you very much.